So many females are scared to use hormonal contraception, and the main reason why they are scared is because they think that they're going to gain weight, and that's make them to search for alternative ways. And it turns out that their partners don't like to use condoms because condoms a little bit decreasing sensitivity, and that's why people are interested in natural birth control methods. But natural birth control methods are that's not really easy to use them correctly, and it's not really easy to understand those methods. So that's why you should really discuss this with your healthcare provider, with your doctor. And I am Dr. Olga, OBGYN, and I want to give you some informational content about this family planning method. And this video shouldn't be considered as medical advice. Fertility Awareness Method is not only one method, but it's a group of methods which based on tracking your ovulation, on tracking your menstrual cycle, because you know that female can get pregnant only one day a month when she's ovulating. You will have intercourse 5 days before ovulation, and 1 day after ovulation you can get pregnant. And this is because sperms can live in female body up to 5 days, and an egg lives up to 24 hours. So these 6 days are called fertility window, and on these 6 days of the month you can get pregnant. And the first method is a rhythm method, and this method needs a little bit of preparation. You need to track your menstrual cycle from 6 to 12 months, and then you will need to do some calculations. Find out what was the shortest cycle that you had. And remember to count the length of your menstrual cycle from the first day of your periods to the first day of your next periods. For example, your shortest cycle was 26 days long. Now you need to subtract 18 from the amount of the days in your shortest cycle. If your shortest cycle was 26 days long, that means that you need to subtract 18 from 26, and that equals 8. That will mean that day 8 of your menstrual cycle is the first fertile day for you. And now find out what was the longest cycle that you had. Subtract 11 from the number of days in your longest menstrual cycle. Let's say that the longest cycle that you had was 32 days long. 11 subtract from 32 equals 21. That means that 21st day of your cycle is the less fertile day. From day 8 to 21st day of your cycle is a fertile time, and on these days you need to stop having sex, use another method of contraception, or switch from vaginal to another type of intercourse if you don't want to get pregnant. And if you are trying to get pregnant, you should have sex regularly during your fertile days. For this method to be effective, you need to continue recording the length of your menstrual cycle and update your calculation every month. For this method, you can use some mobile apps, or maybe you can use a calendar. The next method is a standard days method. It's a little bit easier, it's a little bit simpler than the previous method, and it considers that everyone is fertile from day 8 up to day 19 of menstrual cycle. And standard days method works best if your menstrual cycle is more than 26 and less than 32 days. And of course, it's hard to use this method if your cycles are irregular. Okay, now let's move to cervical mucus method. Well, this method involves checking your discharge through your menstrual cycle. Your periods just stop, you might have not much of discharge, but when ovulation is close, the amount of your discharge can increase, and this discharge will look clear, slippery, and stretchy. It kind of look like egg white. And if you would like to use this method, you better track your discharge for a couple of months, so you will better know and you will better understand how your discharge looks when you're ovulating. And to check your discharge, you can use your fingers, and you can stretch your discharge between fingers, and see how slippery it is, see how clear it is. Well, this might sound gross for someone, but come on guys, it's your body and there's nothing gross about it. I think that the most popular method that many of you may be familiar with is basal body temperature. Basal body temperature is based on tracking your body temperature through the whole cycle. When you're ovulating, your basal body temperature can rise. It can be a half degree higher, and it can be even 1 degree higher after your ovulation. And to use this method, you need to measure your body temperature like first thing in the morning, before you get out of the bed, before you have breakfast or drink water. That's the first thing you do in the morning. Every time you measure your body temperature, you need to use the same thermometer, and it's better to check this temperature like the same time every morning. And localization of where you measure your body temperature should be the same every time. Like you should measure your temperature every time in the mouth or every time in your rectum, but localization should be the same every time. And of course, there are some factors that can affect your temperature, like you may be a little bit sick, or maybe you were sleeping in a colder room than usual, or maybe you had stress before. All this can affect your temperature. And when your basal body temperature stays high for 3 days in a row, that's when your fertile days is over. And again, if you would like to use this method, I will recommend you to track your basal body temperature for a couple of cycles, so you would know and you will better understand how this method works. To increase effectiveness of fertility awareness method, better combine cervical mucus method and the basal body temperature method, and this is called symptothermal method. There is also a variation of cervical mucus method, which is called 2 days method. By using this method, you need to ask yourself just 2 questions. Did I notice any secretion today? And did I notice any secretion yesterday? If you answer yes for both of these questions, most likely you're fertile. If your answer is no, if you had 2 dry days in a row, most probably you're not fertile these days. And again, my recommendation is to double check. Like not only using 2 days method, but combine it with any other, maybe with the standard days method or with the rhythm method. That's really increasing effectiveness of the family awareness method. Natural birth control has its benefits. First of all, it has no side effects and it has no impact on your body. You can stop it anytime. It's for free. And with using this method, you're really going to know your body better, and it will help you not only to avoid pregnancy, but also it will help you to get pregnant faster when you will be ready for it. Because you would know like when it's better to have intercourse to get pregnant. Because you would know like on which days you are most fertile. And of course, this method has not only benefits, but also like risks. For example, none of these natural birth control methods protects you from STI. So if you decided to start to use this method, you and your partner should have STI test, so you would know that your intercourse is safe. It requires a lot of discipline, it requires a lot of self-control, and it's not always happens, so it's easy to get pregnant. Also, you can't use this method if your cycle is irregular. And even your cycle is irregular, you know that it's okay for female to have their cycle a little bit longer or a little bit shorter from month to month. You know that menstrual cycle could vary a little from month to month. So 1 month you can have your ovulation 2 days earlier, and the next month you can have your ovulation like 3 days later than you're expected, and you will never know it. You can't predict it. So it's also increasing the risk of pregnancy if you use these methods. Natural birth control has its risks, so if you have decided to start to use this method of contraception, it will be a good idea to use not only one method, but combine them. For example, you can combine the withdrawal method with the lactational amenorrhea method or with the family awareness method, and it would really make your contraception more foolproof. And remember not to use this method before you and your partner will have a STI test. When you're searching for natural birth control methods on the internet, they might tell you that you should douching with vinegar or lemon juice after intercourse, or that you should put a lemon slice in your vagina. Please never do this, because by using these methods you can actually harm yourself. It can lead to irritation, to chemical burns, and it could lead to vaginal pH imbalance. And recently, in the previous video, we talked about why it's so important to maintain vaginal pH. And I think that it's better to choose a contraception method with a doctor. Thank you for watching this video, and I can't wait to see you in my next one. Bye!